A very warm welcome to all the viewers of my channel and all those who are watching my video for the very first time. I am Jaspreet Arora. I very recently got a message on Instagram related to the request being put to make a video related to menstruation. So this particular video, I'm going to talk all that which I am aware of and which I want my girls and boys to be aware of. I have been a biology instructor, a science educator for some years now. Through my experience, I have learned certain things. There are certain loopholes in the upbringing of our boys and girls. So here I am going to talk about every possible thing which I would like to educate the boys, the girls, the parents and the teachers, which I think can be helpful in the coming years of these teenagers who are going to have the menarche very, very soon. The worst possible question: why do I want to give this information to the boys when they are not going to face any such change inside their body? The answer is very simple. If we want to change our society for a better, we need to have more sensitive and more emotional human beings. We need to raise our boys in a manner that they are more respectful to the female gender. And for that, we need to provide them with the full information what our girls are going through and why are they going through that particular thing in their life. We need to make sure that the boys are given the same set of information as we are giving it to the girls. Because we need to understand this, that we can't leave our future generations confused about their body. So here, to start with, first of all, I would just like to address that why menstruation and when menstruation. There is a stage in the life of the children which we call by the name of puberty. It is the stage which is spread over certain years. Age of puberty lies somewhere between 10 to 12 years of age, and this is not going to be attained by all the children at the same time. It is spread over the years. Some may attain puberty in the earlier years of their life and some may get it later on. When we are talking of puberty, there are going to be certain characters in the body which we call by the name of secondary sexual characters, which will be certain set of characters which will be seen in the body of a boy and girl. And one of such characters which we see in the body of the girls being changed is the onset of menstruation, onset of menstrual cycle, onset of menses. You may call it by any name. The thing is this, that we need to tell the girls and the boys that why this is happening in their body and what are they going to face. First of all, children are our responsibility, and if we are not going to tell them all these things, then whom are we leaving this piece of information for to be told to them? Do you think that God is going to send some messenger who is going to land on this earth and provide the good piece of information to our boys and girls about what is very soon going to be experienced inside their body? We can't leave them in distress, because once the girls, they see it happening to their body, at the very first instant they will get confused. They will not be able to share it up with anybody if they are already not aware about that. So it is our moral responsibility, it is our emotional act towards the boys and girls to tell them about puberty, which we have in our curriculum. But the written information is always not a very clear piece of information. They need a good educator, they need a good hand, emotional support from the parents to need to know that actually how are they going to experience. That is well good and fine that in the science books in 8th standard you are putting up a chapter in which you are covering the menstruation part. But do our children start menstruating when they are in 8th standard? That is the thing. We have early puberties now, or you can say that the age of puberty has changed. And by the time they reach in 8th standard, they have experienced the whole thing. So we need to make them have some sessions with us. Now, what sort of sessions am I talking about? How do I introduce this topic to my child? And when do I introduce it? When the child is of almost 10 years of age, it is important to talk to the child about the scientific terminologies. First of all, the biggest mistake which we parents or which we teachers make is that we are not using the scientific terminologies exactly with the names of the body parts which they should be called by, like breasts. Why are we hesitant in using the word breasts? Anus. If we will be hesitant, then they will get more curious that there must be something special in these parts. That's why our parents are afraid of using these names. So it's a kind request to everybody to start using the exact scientific terminologies which should be used. When your child is about to menstruate, sit with your child in a comfortable place. Do not try to create a mess out of the whole situation. You need to be alone with your child and you have to discuss the topic in the form of fill-ups. You are not going to speak the whole entire thing to the child. You have to start it in a way that you are growing up, your height is increasing, you will see a change in the structure of your body parts. You will see that some of your body parts are going to have a bigger dimension as compared to the earlier parts. And are you aware that there will be some sort of other secretions which will be coming out of your body? And like this, keep on going. Do not speak the entire thing. Let your child poke in and speak certain things from where you will come to know how much you need to tell the child. Now, another very important thing which they need to know is that why are they going to menstruate and what is going to happen when they are menstruating. First question, that why are they going to menstruate? See, it's a very normal thing that the female body has to prepare itself to bear a child. For that, the female body is going to prepare its gametes. By gametes, I mean to say here, an egg is produced inside the body of a female. And that egg is prepared by the ovary. The female body is having 2 ovaries, and every month one ovary is going to release 1 egg. That egg enters into the uterus of the female part, uterus, vagina, ovary, fallopian tube. These are all the parts of the female body. You need to know this, that the child when it is inside the womb of a mother, it is developing inside the uterus. So the egg has to ultimately go into the uterus where it is going to develop into a baby after meeting with the gametes of the male. But in case there is a girl who is of course not married, or there are females who are married and who do not get pregnant because they are using some methods by which they do not get pregnant. In all those, when the fertilization is not going to occur. Now, what do I mean to say by fertilization is when the male gamete and the female gamete, they do not combine. So, this egg cannot stay inside the body of the female. This egg needs to be flushed out of the body. For that, the egg takes the path of the vagina. Through the vagina, this egg, along with the linings of the uterus. Now, what do I mean to say by linings of the uterus here? All the blood vessels by which the uterus was preparing itself to for the development of the future baby. All those linings, all the mucus, all the blood vessels of the uterus along with this ruptured egg, they are going to come out of the vagina, and this whole process is going to take almost, you can say, 5 days. It can be 5 to 6 days or 7 days in some females, but the average time is 5 days. So this whole thing, when it is going to come out of the vagina, will be in the form of a blood, and you need to take precautions. Then when it is coming out, your clothes may not get dirty. And how do we prevent our clothes from getting dirty? We are using pads for it. Pads, we mean to say sanitary pads. As I have already told you that this whole process of menstruation takes about 5 days or maybe a little more than that in some females. So when your menstruation is about to begin, at that time, you are just suspicious that, okay, fine, this particular date, last month, I had my menstruation. So this cycle is going to be of almost 27 days to 30 days. After that 27 to 30 days, I'm again going to experience menstruation. So now you are aware that, okay, on 1st of January, I had my menstruation, and now on 1st of Feb or a little before that, I will have my menstrual cycle. So what you are going to do is, you have to be prepared for it. How are you going to be prepared for it? You have to have a kit with you in which you will be keeping a panty liner, a pad, a panty, and a newspaper. This kit is going to be your menstrual kit, which has to be always there inside your bag. Do not be shy or do not be afraid of carrying this kit, that some boy may open up your bag and may see the kit. It has to be a normal process. We have to normalize this for the boys, because if we want our brothers and our daddies to be more sensitive and emotional towards the pain or towards the whole problem which the girl or the female is facing during menstruation, then they need to know the whole thing about it. So if a boy opens your bags and sees that kit, that has to be taken as a pretty normal thing. I still remember that day when I used to go to school, and our teachers had given special instructions to the boys not to open the bags of the girls. Reason being, they wanted that the girls should have their privacy, and they were afraid that the boys were not knowing anything about the menstruation, so there is no need to tell them. And what I used to observe was that in the library, the same boys used to pick up the biology books of higher grades to see actually the female body diagrams, or you can say to capture the information of the menstruation. Now comes the role of the teachers, that if the child is doing this, then what is the teacher for? Why are we giving special sessions only to the girl students for menstruation. Why are we holding the sessions only for the girls, leaving the boys more curious as to what that session was about? We need to make it sure that our boys are a part of this society and they are going to be the fathers, they are going to be the husbands, and of course they are the sons. We really need to sensitize them. Talking about the pads, I would just like to show you the pads, that how do they look like. Let me show you some of the pads which I am having right now. I will start from the first one, which I told is a panty liner. You can see the size of the panty liner. It has to be there inside your sanitary kit which you are keeping, because this is very soft and is not going to cause any irritation. This is just going to prevent those initial spots which you will get when your periods are about to begin. Then I will just show you a normal pad. This is the normal pad. The size is long, and another thing is that it is thicker. Then we move to the pad which is the XL pad. You can see the length has increased further. And then we have the nighttime pad, which is even longer and thicker as compared to the other pads. Now another thing is, at the nighttime, if in case you when you are putting this nighttime pad inside the panty, at times you are not having this pad available at home. So what you can do is, you can take your regular pad, put it in the panty, and still you will have some area of the panty which will be left at the back, and where the pad will not be there. So there are chances of the leakage of the blood when you are lying down on the bed at the night time. So this is a hack, that you can take a panty liner and you can put the panty liner like this inside your panty, so as to prevent your blood from leaking and making you uncomfortable in the bed at the night, that the clothes have gone dirty and then you have to remove those clothes and everything. Talking about the stains, at times situations are unavoidable and you get late in changing your pads. So you get the blood stain in your clothes. It is very important for the kids to know this, that the stains of the blood, once they are on the clothes, it gets very difficult to remove those stains. So the blood stains should be washed immediately. And in case you are in the school and at that time you got the stain, and then of course you were already having that emergency kit inside your bag, and you removed your panty and you removed your pad and you have discarded the pad inside the newspaper and all that stuff. Now that panty has become late for washing. Now what you can do is, you can use Vanish, you can soak your panty inside the surf to remove those stains. Sun drying. Drying the undergarments in sunlight is very, very important, because sunlight has antibacterial properties. It helps to kill the bacteria. Now, why is it so important to kill the bacteria? Is many times you must have suffered from some sort of itching problems. Panties need to be dried in the sun, so that proper killing of any bacteria which are there in the panty due to them being moist are killed. Then, when we are talking about the sanitary pads, at times the children, they are complaining of some particular type of odor which is coming from the sanitary pads. I would just like to clarify here is that the blood which is coming out at the time of the menstruation is not leaving any sort of odor. Now, from where is this odor coming? This odor is actually from, or you can say secreted from, those chemicals which are present in the sanitary pads. These sanitary pads, if you just see, not of course in this one, see this sanitary pad, just this much piece of sanitary pad is soaking how much amount of blood we are not even aware of. So how is it possible to soak so much of blood, and it is not even having the same color as the normal cotton is having. So it means there are some chemical reactions which are occurring inside this sanitary pad, and that is the reason when we do not remove the sanitary pad or we do not change the pad after 4 hours of time, these reactions, they start causing foul smell. That blood and which is accumulated inside the pad, that is made to react with certain chemicals which are there on the pad, because these pads, they are gel based. They are making some reactions, and they are just helping to clog the blood together, prevent it from leaking. So it's very important for us to maintain a proper hygiene. Cleaning of the perianal area must be done during the periods at least 3 times, and that too from the front to back side, not from the back to front side. This will help in maintaining the hygiene. Now the teachers, they must have another responsibility, is to check the dumping of the pads, because the washrooms which they are generally there in the schools, we have the same washroom being used by the juniors and the seniors. Now when the senior kids, they are discarding their pads inside the washrooms, they should be properly taught how to do that. Nowadays, of course, the pads, they are coming with these packets on the top, so the child can roll the pad inside this and then cover it on the outer side by a newspaper, and then it should be discarded inside the dustbin, so that the small child or the junior child may not get fearful after seeing some blood spots on a pad being thrown into the dustbin, because a child of 2nd standard or 3rd standard is not even aware as to why that blood is being present on that particular pad. So we need to be conscious about teaching our children about the dumping of the pads. Now another very important question which has been seldom asked is about the menstrual cups. What are these menstrual cups, and actually why are we replacing the sanitary pads with the menstrual cups? The menstrual cups are the small cups which are, of course, not introduced to a child who has just attained puberty or who has just attained menarche. They are used by the bigger girls, elderly girls or adults, and they are made of silicone. On this very kind note, I would just like to say this, that it is for the boys to be more sensitive, more respectful, and more emotional towards the needs of the girls. And when it comes to the girls, I would just like to say this: feel proud of the opportunities, of the changes which are occurring inside your body, rather than complaining about this thing, that why is it happening only to the girls. It is happening to you because you are more powerful internally, you are more strong in your mind, you are the ones who can raise a generation, you are the ones who have that capacity for the species to keep going. So feel proud of yourself, my dear girls, rather than feeling the things which are happening and these temporary pains as the taboos. They are not going to stop you from running a race and winning. Rest, you will get to know about the various things about my talk with our dear gynecologist, Dr. Juhi Bhatti. Let's peep into what sort of talk I had with her and what she had to advise related to certain things on menstruation. Dr. Juhi, I just recently had a good conversation with you regarding my daughter facing some hygiene issues related to the periods. So you advised me really well So what is the advice which you gave me? Can you please convey to every youngster? Maybe many will be suffering from this problem and many can benefit from this whole issue. Can you please tell us what are the journal hygienic issues which we need to follow for this?
Actually, personal hygiene in menstruation is very important. So we all should know a few points. Like we have to wash the area with soap and water or Dettol, whatever is preferable, at least twice a day during menstruation and once daily otherwise also.
Okay.
And we have to, if you're using a pad, then you have to change pads every 3 to 4 hours.
Yeah.
Okay, then after you use the washroom, restroom, you have to clean your hands with soap and water and rub it properly back and forth, and every time after you use the washroom. Then dispose of the pads carefully in the dustbin using a newspaper. Don't use poly bags, they are non-biodegradable. If you're using a cloth, then the cloth should be clean. And same rule applies for the cloth also. You have to change it like 3 to 4 hours.
Okay.
Every 3 to 4 hours.
Otherwise, I think we should not be preferring the cloth. What is your opinion about it?
See, the low socioeconomic status people, they cannot afford pads. Though there are very reasonable pads also available in the market, but still they cannot afford it. So even if you're using a clean cloth, that is okay.
All right, fine. I think all of you must have got enough information related to the hygiene issue. One thing more I want to ask is, when we are cleaning our vagina, what is the right product which should be used? Should we be using all those products which are available in the market, because we now have ample of them?
Actually, many washes are available, and like you said, cleaning the vagina. We don't actually clean the vagina. We just have to clean the external area. As per medical guidelines, you cannot put any chemical substance or anything inside it. You just have to maintain the hygiene, clean it properly from the outside. So any vaginal wash like V-wash or Femi-wash, many washes are available in the market, or even simple soap and water. Or like I said, with Dettol. You can wash it with Dettol also from outside.
So fine, I think this is a great piece of information which has been given to us, that we are not supposed to put any chemicals inside the vagina. Sometimes we feel itching in the vagina. So doctor, what are the various reasons for the itching into the vagina?
Itching can be mainly due to UTI, that is urinary tract infection. So applies to this also, that you have to maintain hygiene, you have to drink lots of water, like 8 to 10 glasses of water per day, and you don't have to hold the urine. Okay. Every time you get an urge to pass urine, especially in winters, you have to go and just pass the urine. You cannot hold the urine. That causes stasis and can cause urinary tract infection.
So I think many students, they often ask me this thing about what are the benefits of drinking too much of water. I think one of the reasons, especially for the girls, has been told by the doctor, and we must drink a lot of water. It's good for our skin also. And of course, the topic which we have picked up today is briefing us on this thing, that we need to take a lot of water if we want to keep ourselves away from the vaginal itching. One more question which was asked by too many of them, that was related to the irregular menses. By irregular menses, I mean to say that some girls, they were saying that at times they are having periods maybe twice a month, or at times their cycle is of 27 days, but they are having menses maybe after 20 days. So is there any scientific reason behind it, or it's just anything else?
Actually, menstrual cycle, anything from 21 to 35 days is okay. So need not to worry if you're getting periods in 21 days or after 35 days, that is a part of regular cycle. But anything between 15 days or 10 days, or you're getting periods after 40 days, that needs to be addressed. So stress might be one of the reasons. If your menses are delayed or preponed, like for once a month, then it is fine. No need to take any step. But if your periods are getting delayed for more than 2-3 months, then you need to seek a doctor, and then you can take into consideration few of these things like thyroid disorders, PCOD, PCOS, or
I think PCOD and PCOS are some very, very vast topics. And doctor, do we have any specific age in which these syndromes and disorders they appear in the females?
actually they're very common in reproductive age and teenagers especially.
Okay, teenagers, you mean to say the one who has just attained menarche,
Yeah.
and can be having this PCOD or
Yes,
PCOS?
yes. They're
Okay.
very common in teenagers.
Okay. And I think when it comes to stress, she has already told us that the reason for having multiple menses in a month can be stress. So it's a warning sign for all of us that stress cannot be a solution to any of our problems. Indeed, it is going to elevate our problems. So we should not be taking stress over little things. Rather, we should be working out to solve those problems. So, doctor, anything else you think can be the reason for the delayed menses? Something like pregnancy can also be there?
Yes, pregnancy can also be the reason.
Okay, fine. And doctor, what do you want to say related to the teenage pregnancy?
We should be very frank about talking about menstruation and our reproductive system to avoid teenage pregnancies. So every parent should not only make their daughter educate about menstruation but their sons also.
Here, I think it is the joint role of the educator, the family, the doctors, and all the well-wishers around us, that what we need to really understand to avoid any, uneven circumstances in our life. A very important thing which I want you to take up is that why do we generally feel the vaginal pain? Is it the vaginal pain or uteral pain, abdominal pain? I don't have the right vocabulary to be used there. So I think I would love if you can just throw a little more light on this, that because most of the times it has been seen that the girls, they fear periods just because of that, you can say, discomfort in the body. It can be some back pain, it can be some pain in the abdominal muscles. So can you tell us something related to that, and what can we do to prevent, if we can?
Actually, the pain is because under the influence of hormones, the smooth muscles of the uterus, they contract.
Okay, fine.
So not only uterus, but the smooth muscles of bowel or uterine muscles, they contract, and the pain is actually due to contraction of the muscles. So there is flow of prostaglandins, that is a hormone. So they cause that pain. That is, you can call it a pain hormone.
Okay.
So under that influence, there is that pain that we feel. We can use a hot bottle during the periods. Too much of medication should be avoided. Light exercise like yoga and meditation really helps. So you can do that. You can drink 8 glasses of water. So that helps to lessen the bloating which is there and which causes the pain. You can avoid certain food items, like too much of sodium, salt should be avoided, too much of caffeine should be avoided, too much of sugar or fried food can be avoided. You can take food rich in vitamin D and vitamin B6. They help it to ease out the pain. So you can have green vegetables, some antioxidants, and you can have water again and again. You can have boiled eggs.
Good enough. We have got good knowledge related to the food items which we are wanting here. One thing I would like to add out here is that when it comes to exercising, so many of the girls, they are in sports. So any advice to them?
If they're not having much pain, then they can continue with their regular routine. But I advise not to do a lot of weight training. So you can do running, jogging if you're comfortable with it. Yoga is advisable. You can meditate. But too much of weight training or heavy exercise should be avoided.
All right, fine. I think that's a good clue. Like skipping can be avoided, jumping can be avoided. Periods does not mean that your life is restricted to only 27 or 28 days a month. You can have a good amount of life for those 30 or 31 days if you follow certain rules. And I think Dr. Juhi has already advised us certain very good things related to hygiene, some food habits, some exercise habits. So I am very glad she was here with us, and would really like to thank her from the core of my heart for being a part of this episode on my channel. Thank you so much, Dr. Juhi. So on this kinder note, I would like to say a big thank you to our dear gynecologist, Dr. Juhi Bhatti, for devoting her time to my channel. And in case you have any other such topics which you feel hesitant about talking to anybody, I am always there. I would feel honored if you share such topics with me, because it adds up to my knowledge also, and it helps to make me a better human being. So thank you so much, friends, for giving me a chance to clear up certain things in your life I feel important. Thank you.